think mental health is wealth, because without mental health, there's no health really, is there? It's like your mental health really helps you function with day-to-day life. Your physical health, it all goes in together, doesn't it, hand in hand? So, you know, if you're not managing your mental health, everything else can start falling apart. So I think mental health is wealth, personally. Well, a lot of things that people don't always know is that if you go to a therapist and, you know, you've been for a few sessions and you're not building that trusting relationship with that counsellor, or you feel like that counsellor's style doesn't suit your needs, you can actually ask to be referred to another counsellor until you find a counsellor that helps you and works for you. Because sometimes you can go for therapy and be with a counsellor for 6 months, but if you haven't built that relationship with that counsellor, it's going to be a waste of the counsellor's 6 months and a waste of your 6 months, because you're not going to benefit from it. So it's important that you find the right counsellor that you're going to benefit from and that you'll be able to grow through. No, I don't personally think you can, because I think things in life are always going to happen. Life's a big test to us, you know, and mental health can always be affected by little things or big things that do happen in your life. So, for an example, you could lose your dog tomorrow, or you could lose your nan in 12 months' time. You could lose your job, you could lose your house. All them things are going to have a strain on your mental health. So, no, I don't think it can be prevented. I think you can build yourself up for resilience for it by learning coping mechanisms and strategies that will help you build that strength up for it. But I think if without them and without knowing it now, I don't think you can prevent it. Keeping a check-in on yourself every day, asking yourself how you're doing today, is really important, because people don't do that. People just get up and go to work and don't have no time to think about themselves and look at within. So I think if people monitor themselves daily, they can start to see when things are slipping a little bit, whereas because people don't, people get up every day and do the day-to-day things, and then the next thing they're having a breakdown because they haven't took that notice of something's creeping up on me. And I think if they can, as soon as they notice that something's not right, go into it. What is wrong? Where is it coming from? Seek help, talk to a friend, you know, get it out there before it goes too far. There's cures, yeah, because obviously people can take medication if they need to. I'm not a big fan of medication from my own experience of it. Don't get me wrong, at the time I needed that medication, you know, the place I was in, I needed that medication, and I do believe it does work, but the physical elements of it and the damage it can do later on in life, I don't agree with. So I think medication can work for short term, but if you go to a doctor's and you tell the doctor you're feeling depressed, the first thing they'll do is, take 2 months of sertraline, rather than get your therapy ASAP. You'll have to wait 6 months for a therapy. And I think if people went for therapy first, then if that didn't work, they went for medication, it would be better.